Welcome, everyone, to another episode of Three Plastic Surgeons and a Microphone. As always, I am Sam Jejurikar in Dallas, Texas, and I am joined by Dr. Sam Rhee at Bergen Cosmetic, who is in Paramus, New Jersey. And as has been a recurring pattern lately, we are joined, instead of Dr. Pacella, by Dr. Larry Tang. Larry Tong, I'm sorry. Oh, my God.
Thanks.
I swear I've known Larry for
Beloved
like
guest.
25 yers. But Larry Tong at Yorkville Plastic Surgery in Toronto. Boy, that's embarrassing. Actually, I swear I know Larry. No, let's capture how bad this intro was on my part. Okay. But we're going to talk about an interesting topic today, something that I think every plastic surgeon in America is facing, which is how to deal with some of the newer weight loss medications and what we're seeing in our patients. Before we get into the meat of it, we have a disclaimer. One of you gentlemen want to read that for us?
Sure. All right. This show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your qualified health provider with any questions you may have regarding medical care, and never disregard professional medical advice or delay seeking advice because of something in this show.
All right. So before we get into the meat of it, just a little background for our viewers. I'm sure if you are paying attention to what's going on in the news, you hear about medications like Ozempic or Wegovy or semaglutide, and then a newer one, Mounjaro, which goes by the name of tirzepatide, and then it's got a new name too for a new indication. And basically, these medications were first kind of brought into the spotlight about a year or two ago. They were initially marketed for the treatment of type 2 diabetes, but they realized during the clinical trials that weight loss was actually a really common thing that occurred with this as well. And so they now, both Mounjaro and Ozempic have been rebranded and also have FDA indications for weight loss. So first thing I'll ask you guys is, how many patients or what percentage of your patients do you actually think you see are taking these medications?
I would say a huge proportion, and it's growing, I think, every month. I have also seen patients who I originally saw maybe a year or two ago, and they really weren't body contouring candidates, and they've come back after having been on these medications, and it's a life changer for a lot of patients. Not only that, I know colleagues and friends and other people that just who are not patients who have been on this medication, and I've seen some really, really dramatic changes in them. So it's everywhere. I mean, it's grown tremendously in the past year.
Yeah, I agree with you. There's a very significant amount of patients and people in general who are on these drugs. And I'm sure everybody out there knows someone who's on these drugs. The funny thing is that a lot of patients do take this, even though these drugs, even though they're not diabetic, a lot of patients are really just taking these drugs for weight loss. So what I mean is Ozempic, for example, is not specifically for weight loss, as Sam had alluded to, but a lot of patients are getting prescribed this, and we are starting to see a lot of patients that benefited from this, and it has also, started to generate plastic surgery demand for various procedures.
When you say that it's generated demand, like what kind of things are you seeing in your practice, Larry?
So one of the things that people might have heard of is something called Ozempic face, and that's really just what happens when you have significant weight loss in a short amount of time, and that results in sagging of the skin. I think that what's happening is maybe because the weight loss is so rapid, the skin doesn't have as much time to sort of catch up, and you're going to see either sagging and loss of volume because the fat is. So one of the things that we're starting to see is fillers, fat grafting, or other types of volumization to compensate for some of these changes.
Do you guys, so I was pointing at myself when you said that because I've been on Mounjaro for more than a year. And I started it because I'm pre-diabetic. My A1C normalized with it. But now my doctor tells me I can never get off of it. And I 100% agree with you. There's definitely volume loss, but I think it's more than just traditional weight loss. I think that certain fat pads that we lose weight in different ways. Like I have lost malar fat. For patients that are out there, buccal fat pad removal is a common procedure we will do for our patients. And literally with Mounjaro, I feel like I've had the effect of a buccal fat pad removal. Like I have defined cheekbones. In some ways, there's been some good cosmetic benefits that go along with it. But then lower facial sagging, hollowing of the lower eyelids, hollowing of the temples. It's really interesting that I think the weight loss, at least in my observation personally and in many patients that I'm seeing, the weight loss isn't just good weight. It's like it's very prematurely aging weight loss.
Yeah, I think for patients over the age of 35, when I see them, they lose it in the temples and you can see it. You can literally see this sort of flatten or hollow. And then I think the other area is the malar, the cheek pads, because they start getting this deeper nasolabial fold look. And you're right, those are both areas that sort of prematurely age you. And the question I always have with patients when I see them for these types of indications is how long are you, like you said, how long are you going to be on this medication? What happens when you get off of it? Are you planning on getting off of it? Because those are also things, especially not just for facial procedures, but for body procedures like body contouring procedures. You don't want to get caught in a situation where you do something and then they get off of these medications and then they gain a significant amount of weight back, which is what I think studies have shown so far, that if you stop these medications, the weight gain returns pretty quickly.
Yeah, the clinical trials show that if you follow these patients out about a year, um, even with lifestyle modification, assuming that's happened, that they gain about 2/3 of the weight back over the span of a year. Now there's a lot of weight loss doctors that are coming up with their own protocols to try to taper people off of this, which they insist lead to less weight gain. But at least the studies so far haven't actually borne that out.
Well, let me.
Do you guys
Oh, go ahead.
go? No, you go ahead.
I was just going to ask, where do you guys see patients and decide this is something is that's more non-surgical? Say uh, treatment wise for skin versus something that maybe requires more of an invasive, like surgical type procedure. Like where do you see that with these types of patients?
Well, I would say generally, if you're um, talking about cosmetic surgery and surgery versus non-surgery, patients have to understand that there's a limitation to what can be achieved with non-surgical procedures. So filling with volume, like fillers, is perfectly acceptable when you've had a little bit of deflation in the face. But if you have a lot of sagging, patients should not expect fillers to be able to lift. That's something that I stress patients, that lifting is not really a realistic expectation for fillers. And then when it gets to the body in general, you're not going to be doing any sort of non-surgical procedures. The skin tightening machines and things like that only provide a very modest or even negligible degree of improvement in those areas. So a lot of patients with sagging skin in the bodies will generally need some sort of surgical procedure. So I think that's important for patients to understand that the face, where you have a choice often between surgical, that, surgery is much better suited to lift things and remove excess skin. And if you choose to go with a non-surgical route, you just can't have the same expectation as having surgery.
Yeah, I 100% agree with everything Larry just said. Just to kind of build on that a little bit more, it comes down to the amount of time people have to recover. Surgical procedures, whether it's the face or the body, you're looking at several weeks of recovery, whereas injectable treatments are you know a relatively rapid overnight recovery. Comes down to expectations. Like Larry said, if you want big expectations, you need a big recovery and you need surgery. But if you're willing to do sort of incremental treatments to get incremental benefit, non-surgical stuff might be useful. I personally find that when it comes to technologies for skin tightening, with most commonly radiofrequency or ultrasound, that weight loss patients, if it's been large amounts of weight loss, their skin elasticity just isn't very good. Even the best technology tends not to have huge benefits. But if it's a moderate weight loss and a younger patient whose elasticity is better, maybe we can achieve some better things with radiofrequency. So there's not sort of a straightforward answer to that question as well. You know, I feel like patients kind of drive the conversation, though, Sam, to answer your question. They kind of come in knowing people are really educated and they generally know what it is they think.
Would you say, and because you've gone through this process, Sam, and your face looks pretty good actually, would you
Or damn
recommend that
good.
yeah, damn good is actually what I would say. Thanks, Larry.
You guys are going to make me blush.
Um, would it be worthwhile to tell patients who start these medications as they're starting to lose weight to get a jump on some of these non-invasives and say, listen, don't wait until you lose 30 pounds before you get treatment. Like, maybe start some of these non-invasives early and often. If you if you have the money, because this stuff isn't cheap, but if you have the ability to do so, maybe that might help mitigate some of these issues.
Oh, because I think everybody loses weight a little bit differently with these medications, and if I go back and critically look at my face before I started these medications, my face was chubby. So to add a bunch of filler to my face to kind of preempt that would have not necessarily been a great thing. There are things though that I think are really beneficial that I recommend to all patients. Like I think radio frequency treatment is really great. I use a home radio frequency device. And I have for a couple of years, and I think that's a helpful thing. And I try to get people to do that. I think skincare with retinols is really important. I think a lot of the things that are important now are true regardless of whether or not you're about to lose weight. For body contouring stuff, I just don't know how you would like pre-treat and lose skin before it actually happens.
What is the
Yeah,
can you say what the RF frequency device is that you use?
I forgot. I literally can't remember the name of it. If we'll remember for the next one, I'll pull it out.
Okay.
I agree with Sam with that. I don't believe it, and I wouldn't think that it would be easy to predict how you're going to preemptively treat someone. Maybe counsel the patient that, once you start seeing things come on in quickly and we can sort of mitigate any of the extreme changes that you see. The other thing is, though, is there a role for changing how you're taking these drugs? Because there is a sort of a ramp up to the dosing schedule, and maybe if they go a little bit slower, they wouldn't see the significant changes. They're concerned.
Are either of you worried about patients on the medication when they have their surgical procedures? I have seen some considerations since they delay gastric emptying that there might be some side effects to the anesthesia as a result of being on these medications when they're getting surgery.
Yes, I think that's a definite must. Whenever somebody is going under anesthesia, for the viewers out there, when you go under anesthesia, general anesthesia specifically, you're going to be intubated. And when that occurs, intubation is putting a tube down so that you can breathe when you're under anesthesia. When that's done, there is a risk of something called aspiration. And that occurs if you have food in your stomach. And because your reflexes are altered by the process of general anesthesia, you may cough and have food inadvertently go into your lungs, and that's a very serious complication. So what happens with these types of drugs is one of the effects is that gastric emptying slows down, meaning the rate at which the food leaves your stomach is much slower. So the additional advice we've been giving patients, stopping food maybe at least 8 hours surgery might not apply. And actually, there has been many reports of increased risk of aspiration. So we have to make modifications to when patients should stop eating or drinking. And right now, I think the standard recommendation is if you're taking Ozempic, which is at once a week, you should stop for at least 1 week prior to your surgery. So you could miss or purpose that dose. If you're on an oral medication, Gobi, which is Rybelsus,
Rybelsus.
which is taken every day, at least 1 day beforehand. But I think the information on that is still evolving because there's still some concern that gastric emptying is actually affected even beyond that stopping of 1 week. And there was a recent editorial in the Canadian Journal of Anesthesia, which had recommended considering even stopping 3 weeks before. Now, if a patient is a diabetic and needs these medications, then say, that should be done in consultation with their endocrinologist. But to Sam's point, there is a special consideration patients on these types of medications when they go into anesthesia.
Yeah, there's at least one case report that shows a patient with a full stomach who was on the medication 3 weeks, even after having delayed it for 3 weeks. So I tell my patients 2 weeks for Ozempic to not take it. That's what my anesthesia group wants for all of our patients.
Let me ask you this. If you have a patient who comes in for body contouring and their BMI is pretty high, I have heard of some plastic surgeons who actually are prescribing, managing weight loss pre-body contouring surgery and, taking them through that whole process with Ozempic and then operating on them. How do you guys feel about that? Do you guys do that? Do you recommend patients go on Ozempic if their BMI is high and they're looking for some sort of body contouring procedure?
I do it, yeah, but I make a point of letting people know, look, I'm not a weight loss doctor, so I'm not in the Ozempic prescribing business for people that are not surgical candidates. Once they're sort of enrolled and they're going to be our surgical patients, we will get them ready. And we've had patients lose 100 pounds on these medications before surgery to get them ready. We check labs every 3 months on them. We check, labs beforehand. We counsel them on contraindications like multiple endocrine neoplasia syndrome and certain types of thyroid cancer. And so we do all of that. And then we actually will work with a compounding pharmacy that will help them get it at prices that are a little bit more affordable. So yeah, we do it. But again, there's a danger because I don't want to be a weight loss doctor, but I think I can get better surgical results if people lose weight before surgery.
Yeah, I don't go that route. It's a little bit, more difficult for patients in Canada, however, to ask their family doctor or whoever managing their weight to just put them on Ozempic for the purposes of weight loss. So, it's a little bit different situation Canada. To Sam's point, I think definitely Ozempic and these types of drugs can make a significant difference if a patient has high BMI, bring their weight down. You're getting results that are similar to, bariatric procedure. This is quite a change in, the management of obesity. So I think these drugs are here to stay. They're very important. They do have, side effects and need to be monitored properly.
Well, I thought of the name of that radio frequency device. If you still want to know it, Sam, it's
Yes.
tripolar. It's tripolar with 2 L's.
Oh, okay.
I stumbled upon it in the Dubai airport a few years ago, and they do sell it in the US too. It's reasonable. I mean,
And
it's
you
not
use
the
it
same
every
thing as
day?
no.
Oh.
I use it like once every week or two.
Oh, wow. And you've seen a real difference, you think?
Not sure, but my face hasn't my face
Not
hasn't
sure yet.
sagged as much as my face hasn't sagged as much as I would have thought of given the weight loss that I've had.
Oh.
I mean, I'm a moving target, so it's hard to know, right? I definitely have some loose skin here, but it's not as bad as it could have been with the weight loss that I've had.
Speaking of devices, know that we had a previous episode where we talked about the dimple maker. And I know that you have actually purchased the dimple maker, as we discussed on that last podcast episode. And if you're listening, I mean, if you're
I'm
watching us
not.
on YouTube, you can see it, and you can actually see
Inaugural. This
Dr.
is not easy to get in here.
Dr. Jejurikar is actually inserting it into his mouth. It looks like a clip with little balls on each end, and he actually put it on his right side of his cheek. How does that feel?
Something Dr. Tong has a lot of familiarity with.
What is that?
Putting little balls in your mouth.
Well, I don't see you that often.
So my initial thoughts is that it would be very difficult to get anything done while wearing this.
Okay.
Because it gets your attention. It's a little painful. I could see where if I left this on for several hours, I might get full thickness necrosis of my skin because it would definitely cut off the blood supply. I don't know how long to leave. There were no directions that came with this. It was $7 on Amazon, but it came with no directions. So not clear how long I'm supposed to wear it for or not, but maybe I'll just try it through the end of this podcast and leave it on.
It looks like
Give you a
some
report
weird
before we do the
piercing,
next one. Yeah.
So what would you say the pain level is on a 1 to 10 scale when you're wearing it?
Look at 3, but like enough where it's hard to focus. Like I couldn't like sit down and do work while I was doing it. I just can't like work on my computer, and I would have a hard time sleeping. So I don't really see this as a sustainable thing.
And I think just looking at you putting that in and seeing how tight it is, I don't think any of us would ever recommend anyone actually trying this. It sounds like you could actually hurt yourself pretty badly with it if you left it on for any amount of time.
The potential for badness exceeds, I think, the efficacy of this.
Thank you for being a guinea pig.
Yeah, that's right.
That's what we do. That's what we do.
Right. Anything for our listener. Okay.
Ooh, I got look like a little dimple there. You see that?
Oh yeah. Oh, there you go. You can see it there.
There you go. Let's see how long it lasts.
Yeah.
You look so much cuter with that too, Sam. Let me tell you.
Nothing like a aging face with a dimple in it. So.
All right. Well, is there anything else you guys want to talk about with Ozempic and weight loss and plastic surgery?
I was just curious, Dr. Jejurikar. You had said that your doctor who's prescribing this said you can't ever go off of it, and it's just because for the reasons that they're concerned that you're going to gain weight. Was that correct?
No, I went on it because my hemoglobin A1C was high. And I have a strong family history of diabetes. My dad was a type 2 diabetic for about 50 years before he passed and was on insulin forever. And so before I started, I was really had changed my lifestyle a lot. I've lost weight, diet and exercise, but my hemoglobin A1C had actually climbed to like almost around 6.
Wow.
So I started this medication, precipitous drop in my A1C, weight loss accompanied it as well, and I didn't mind that. So now my hemoglobin A1C is like 5.0, like it's really low. So talking to my doctor, I was like, I don't really want to lose any more weight. Like I look gaunt. Can I get off this? He said, I mean, not really. For the reasons that you're on it, has been effective. It has minimal changes in your lifestyle. You've got changes, in like minimal side effects. You really shouldn't ever get off of this. So that's why I'm not getting off of it, because control my hemoglobin A1C. But my dosing. So the modifications that we made was for Mounjaro, it goes from 2.5 to 15 milligrams. That's the typical once a week dose. I have cut my dose down to 2.5 milligrams, and I only administer it every 2 to 3 weeks. We check my hemoglobin A1C every 3 months. I still try to be pretty good with diet and exercise, and so that's kind of my my way of doing it. But I don't think we've figured out for every patient, like what's the right long-term dose.
Is your weight stable on that regimen?
Well, I've actually tried to put weight back on. So I lift weights and try the Sam Rhee, lots of protein, and I've upped my testosterone dose. So I've actually gained about 10 pounds.
Oh, nice.
Very good. Well, I think that, these drugs, unless there's some hidden really bad side effects that we don't know about or with long-term use, I think they're here to stay. I think the drugs are going to continue to improve. The newer generations of these drugs will have less side effects, would be more tolerable. So, we didn't really mention it, but some of the side effects, common side effects are like nausea, diarrhea, pancreatitis. There's some more serious effects like cancers are at high risk. So hopefully, as time goes on, the side effect profile will decrease, the efficacy improve, which means that we might, as plastic surgeons, be seeing a lot more patients who are in need of our services in terms of non-surgical surgical procedures.
Yeah, these medications are not going anywhere. Now, like the latest thing, the frontier for them is addiction management. I don't know if you've seen this, but there's thought that the desire in alcoholics to drink really goes down quite a bit. So I have several patients in my practice who are on it for addiction management, obviously weight loss, obviously diabetes. A lot of internal medicine doctors are saying that they're seeing that cholesterol profiles are coming down and improving with this as well. And so there are definitely side effects to them. And it's unfortunate patients do have them, like profound delayed gastric emptying and paralyzed stomachs, but I don't see them going anywhere. I just see their use going up and up. So.
Can't wait till they start putting it in our water. That's what's going to happen next. So everyone's going to be on it.
Yep. Well, I think we should probably wrap it up, gentlemen. We're kind of approaching that time.
Yes. Thank you so much. I learned a lot on this one, especially the dimple maker and the whole ball thing. Thanks very much, guys, for sharing that with me.
You're very welcome.
We
go personal, but we shared it.
Exactly.
All right. Anyways, nice to see you guys.
All right. Thank you.
Take care.